All right, welcome to our final session of our Move and Learn series. And today we are going to be discussing men's health because June is Men's Health Awareness. So we're going to start off with the learn portion of our Move and Learn. And I'm going to go through a PowerPoint presentation with you all. And this will be about 5-7 minutes. And then as soon as we're done, I will turn it over to Team Leader Eric, and he is going to go through some flexibility stretches to help improve our range of motion and flexibility. All right, so let me go ahead and share my screen for you all. And if you could just give me a thumbs up to let me know that you can see it, awesome. That would be great. Okay, so health maintenance for men. Okay, so quick little guide here. We're gonna just briefly discuss routine screenings for men, some regular exercise, a mix of resistance and cardio, stretching for longevity, and that's the move portion of today. We'll go over some stretches specifically, and we'll also talk about sleep and skin protection. So screenings to consider for men. As with women, definitely want to make sure that we check out our heart and that men get checked for blood pressure and cholesterol. For skin and dental here, annual visits, visit with a dermatologist for skin, and with a dentist for the cleanings. The recommendation is an annual or even biannual teeth cleaning. There's also some preventative screenings, flu shots or other vaccinations. And for prostate screening, we hear a lot about that. So things to consider are family history, and regular screenings start at age 40 for higher risk if it does run in your family. And if it doesn't, then the recommended age for that is 50. There's also cholesterol screening. So annual screenings begin at age 50, unless there is family history that suggests checking it out earlier. Also testosterone checkups. So when you go to your primary care physician, the best thing to do is ask, what are all the preventive screenings? What are all the things as a man that I should consider and want to look for in terms of just a general overall screening? Just as with women, where we have a well woman exam, there are things very specific for men too. Nothing happens until something moves. So we definitely want to get the body moving. Very important for men's health, which we'll do in just a few minutes. So speaking of getting the body moving, we want to discuss exercise and how that's really important for men's health. And the recommendation is mixing it up. So we definitely want to do a mix of everything: resistance, cardio, flexibility training, all of it. Resistance, we know, builds and maintains lean muscle mass, helps to burn more calories. Cardio helps to improve heart health, which is so important for men, and checking with blood pressure and just overall general heart health. And then there's HIIT training. HIIT is high intensity interval training, and it's sort of a mix of resistance and cardio. It's less time, so the effort is a little bit higher and the intensity is also a little bit higher. So you're doing a little bit higher intensity for a less amount of time. That's what HIIT training is. Also called at intervals, which has been shown to really help improve heart health. Incorporating stretching and or yoga is so important, especially for men. Sometimes the focus can be just on cardio and strength. So we want to make sure that men are also focusing on flexibility and incorporating that into a regular routine, which is why we're having this Move and Learn session today. Not only does it help with flexibility, but it also helps improve joint range of motion, specifically as we continue to age, and it also helps in performance in other areas. Sleep, so important. And this entire month, we've actually been posting information about sleep hygiene on our Facebook and social media pages for Wellness Wednesday. So sleep is very important for overall performance, overall wellness, and studies show that most men do well with 7 to 9 hours of sleep. And the sleep actually is shown to have a reduction in heart attack. So sleep is when, we're giving our bodies that rest and that time to recharge so that all of our systems can function properly. And that's why it's so important. So a couple of different things here for sleep quality and things that help to improve sleep: keeping a cool environment, limiting caffeine and alcohol within 2 hours of sleep, and of course, screen time, as we know, is a lot of what we do now working from home. We have a lot more screen time, so it's really important to reduce that in order to get a good night's rest. Protecting your skin. This comes at a great time because next month in July is all about UV safety and sun awareness and making sure that we're protecting our skin. So we want to make sure that both men and women are very aware of this. And skin cancer is most common cancer in the US and is actually more common in men. So it's important that we do address this. And the times when the sun is the strongest is between the hours of 10 a.m. and 4 p.m. And now that some COVID restrictions have been lifted, a lot of people want to get outside and we want to be outside. So we do want to make sure that we're being aware of being in the sun. And even if you are covered or have a covering, it's still really important to use sunscreen. So here we say, wear protective clothing, sunglasses, but even still, I'll say, example, last weekend I was out in the sun, I was covered, I still got burned because I didn't put sunscreen on. I thought because I had a covering that I didn't have to. And I wasn't sitting directly in the sun, but even just a few minutes in that harsh sun and the rays can really do some damage. So really important. And that's where that routine skin cancer screening and those visits with the dermatologist are going to help with this. So that's the end of our learn portion. If we have any questions, we can open it up to that. And if not, I'll go ahead and turn it over to Eric so we can go into flexibility and move portion.
Okay, it won't let me unmute for a second. All right, so this is the time to move, all right? So we're gonna focus on the shoulders and the hips, all right? So that's very important to protect these joints and keep these joints healthy. A lot of muscles connect to these joints, so if you do not take care of it, you will feel the pain, all right? So we start with the upper body, move it down. We have about 4 exercises here. If you have a band nearby or a towel, go ahead and grab that. I'll give you guys a couple seconds. Go ahead and grab that. All right. And we can get started here. So the first movement here, we got some banded shoulder rotations. All right. So you can grab your band or towel. This is very important for shoulder health, like I was saying before. Rotate the cuff muscles. All right. So it's also a great warm-up that you can try before your chest, back, or shoulder day. All right. So start off here, arms in front of you. All right. Start about chest level or a little bit below, bringing it up overhead and all the way down as far as you can, as far as your mobility allows you to go, and bring it back, all right? So if you feel like you can't come all the way back, just go as far as you can go. You will find the more you do it, the farther you can go back, all right? So nice and slow here, nice and gentle. Try to also keep that core tight, nice, upright upper body. There we go, there we go. With this, I would recommend trying about 10 to 15 to really activate those muscles there and loosen it up, all right? You try it one more time, so choose. All the way back and bring it back up. You might find that this last time you might got a little bit farther than the first time, so that's progress there, all right? So that's a good exercise to try out, banded shoulder rotations. Good to get that rotation in that shoulders, loosen up those muscles up there, right? Another great one is a banded pulley stretch, all right? So keep that band in hand or towel, all right? I'm gonna start with my right hand in the back. I know my right side is a little bit tighter than my left, all right? So grabbing that, using grabbing that band with that left hand, overhead, right hand comes behind your back, hold on to the strap around your hip area here, slowly pulling it up your back. Remember, tight core, nice upper body, slowly pull it up as far as you can. Hold it for a couple seconds, about 5 seconds, then slowly bringing it back, all right? So nice and gentle here. You don't want to force it up. Nice and slow control, all right? This promotes some internal rotation of that shoulder and helps keep that shoulder nice and healthy, be able to move in all planes of motion here. So we try it again. Hold it for about 5, maybe 10 seconds if you so choose, all right? Maybe you can also try a couple reps here, maybe 10 reps, 10 to 15, holding it and slowly releasing, all right? So I would advise you try both sides. I already know that my right side is a little bit tighter than my left, so that's why I did it on my left side. On my right side. So try it out. Remember, nice and gentle, not really pulling, using that band to bring it up and control and back down, all right? So the top hand is controlling the motion and dropping it back down nice and gentle, all right? So that's the second one. Third one here, we'll get into some T-spine rotations, all right? So when you're ready, hop on the floor, all fours position here. Make sure the knees are in line with the hips and shoulders in line with your wrist, all right? So we're here, engage that core, all right? The movement here. I'm gonna start with my left hand on my head. All we're doing to get that full range of motion, bringing that left elbow to touch that right hand and opening up as far as you can through that elbow and back down, nice and controlled here. So inhale, exhale as you open up. Again, you might find yourself get a little bit higher the more you do it here. All right, try one more time on this side. Inhale, exhale, and switch, all right? You drop the hands to the floor. We try on the right side, couple here, all right? Same thing here. Remember, bringing that right elbow to that left arm, opening up through that right elbow, all right? So make sure the movement's coming from that torso, all right? You don't want to open up the hips. Keep those hips squared. Just working on that T-spine mobility here. Opened up. One more time. And back down, all right? Loosen up there. So now, we did T-spine, just some shoulders. A little bit more shoulders, but in different position here, all right? So if you have a foam roller, you can grab that. If not, I'll give you an option to do without, right? So we'll start here. I'm gonna lay on my left side here, all right? Left hand, arm in front of me. With that foam roller, if you have one, place that right hip on that foam roller so the hips can stay steady. The movement should just come from the upper body, all right? Or if you don't, you can use your hand to place that hip down on the ground and start the movement here, all right? So arms are in front of you just like this. All we're doing, open books. We're gonna open up as far as you can to the opposite side, nice twist. Inhale, exhale, and bringing it back, all right? So if you need to, you can get something for your head to rest your neck on, all right? Or kind of lean down that shoulder there. So inhale, exhale, open up as far as you can. Remember, keep that hip steady. The movement comes from the upper body and bring it back. Another motion you can try here, a sweeping open book. So with this one, coming up and around, all right? So up and around, all right? So here, up overhead, bring it all the way down as far as you can towards that hip area and bringing it back, all right? Try one more time, up and around. There we go, there we go. Open up, you can look to the opposite side, get a little deeper stretch there, and bringing it back, all right, and relax, relax. So those are some of the stretches you can try to loosen up that T-spine, shoulder area. Make sure you stay nice and healthy and promote some good health there, all right? And we'll finish off here with hips, all right? So if you're like me, you have really tight hips, all right? Always have to work on them. So we're gonna start with some 90-90 internal rotation, all right? So to get started off, I'm gonna use my right hand, my right leg, the inside part is pointing towards the ceiling. Outside my left leg, knee is pointing towards the ceiling there, all right? So 90-90 position. You can start set up nice and tall to start off. Next, use that left hand. You reaching towards that right side here, bringing it down. You might feel a nice good stretch in that right hip. From here, nice and gently lifting up that left leg or that left foot off the ground, keeping that knee on the ground, lifting up, internal rotation, dropping it back down nice and easy here. So as far as you can go, inhale, exhale, promote some internal rotation here. Hold it up and down slow. All right, try one more. Up, down, slow. And when you're ready, switching to the opposite side here. Same thing. 90-90 internal rotation. So up, reaching with that right hand towards that left side. Same thing here. Keep that leg in a 90-90 position. Open up as far as you can and back down, all right? So with this one, maybe you can try a couple of reps, or you can hold it here for about 30 seconds and add that nice controlled internal rotation there of that right hip. Inhale, exhale last time. Inhale and exhale, drop it back down. All right. After that, you can try something like doing little 90-90 switches here. So it's here switching, and that will help out loosen up that hip as well. Try a couple of these. I like doing these in the morning when I'm almost done with my yoga sessions. All right. So a couple of those and relax. All right. So you will see the difference in your hips. Try these throughout the week, throughout the day. All right. Keep those hips nice and healthy and loose. Next, we'll try a longest adductor stretch. All right. So we all know the adductors can get really tight, which can pull that hip in and cause problems throughout the hip if you don't stretch out the inner thighs and muscles in that area. All right, so the longest adductor stretch, to get it started off, you're gonna start with the right leg, left knee down, kicking that right leg out to the side. All right, just like this. Start nice and tall, and we're gonna push those hips back nice and gentle. So get as far as you can, nice and comfortable. You feel a nice good stretch there. If you want to take it up here, all right, you can open up that foot towards the ceiling here. So we're here, open up that foot towards the ceiling. You might feel a little bit more in the hamstrings there and back down. So you open up that, open up that foot towards the ceiling and drop it back down. Or remember, you can just hold that stretch. A nice deep stretch in that adductor muscle. Try one more time. And relax and slowly release. We're switching sides here. Kicking that left leg out to the side. Same thing. Get set up nice and comfortable. And pushing those hips back. Nice good stretch in that adductor muscle. And open up. And dropping it back down. Remember, you can just keep it there and hold that position without opening up that foot towards the ceiling. And one more time. Up. And drop it back down. And slowly release there. Good stretch for the adductors. All right. We go head to our back. If you take yoga, you might know this, the bridge pose. All right. So to start this off, engage that core. We're going to lift through the hips. All right. When you get to the top, you do not want to be on your neck. All right. You want to rest on your shoulders. So lift through those hips nice and high. And with this one, I like holding for a certain amount of time, maybe 10, 15 seconds, engage those glutes. And you can drop it back down, all right? So lifting up nice and high, a little bit higher than a regular bridge here. Might feel a little stretch in the back. Also with the hip flexors, you stretch there and drop it back down one more time. Lifting through those hips. And we're resting. The weight on those shoulders, not on your neck, all right? And drop it back down, nice control. All right, so again, I like holding that for a certain amount of time, about 10, 15 seconds, just to feel that stretch. And I try a couple reps as well, all right? And to end it off, we got a lying quad stretch, all right? So we have a strap or a towel nearby. Go ahead and grab that. We end off here with a lying quad stretch, all right? So to set it up, you'll be lying on your belly just like this, all right? Placing the towel or strap around your foot, all right? If it's on the left side, you can use your right or left hand, whichever's more comfortable for you, to pull that leg back nice and gentle. And with this one, you can also engage the core, squeeze the glutes. You'll feel a deeper stretch in that quad and also around the hip flexor area, all right? So with this one, I just like holding about 30 seconds. We probably hold it for a couple more seconds before we switch. Continue to breathe, nice deep breath, and slowly release. Switch sides. Same thing here. A good stretch to loosen up those quads, especially after sitting all day or after a run, all right? And last one here, hold it. Nice deep breath. And squeeze the glutes, engage the core. You would definitely feel a deeper stretch in that quad. Hold it. And slowly release. All right. So again, you hold that stretch for about 30 seconds. Maybe try 1 to 2 times. See how it feels. Hands loosen up there. Remember, all these things can be used as a cool down, as a warm up, or even as a stretch break throughout the day. All right. So check it out so we can keep your shoulders and hips healthy. All right.
Awesome. Thanks, Eric. That concludes our Move and Learn session. So hope you all learned something, and email us if you have any questions.